Worldwide, over 500,000 women and girls die of complications related to pregnancy and childbirth each year. Over 99% of those deaths occur in developing countries such as Nigeria. Nigerian maternal mortality rate continues at an unacceptably high level. While maternal mortality figures vary widely by source and are highly controversial, the best estimates for Nigeria suggest that approximately 54,000 women and girls die each year due to pregnancy-related complications. We see similar dismal statistics where it concerns children. And the tragedy of this is that most of these deaths can be prevented with effective healthcare services. Reducing maternal mortality and disability will depend on identifying and improving those services that are critical to the health of Nigerian women and children.
Tabitha is a specialized medical center that provides state-of-the-art healthcare to women and children. We promote wellness through preventive healthcare, counseling, and the use of current advanced medical technology. We have a stellar medical team that includes American-trained and board-certified consultants in obstetrics, gynecology, and pediatrics. Tabitha Women's Health maintains best practices and is registered with the Federal Capital Territory Department of Health as a licensed medical facility.
Recent UNICEF statistics show maternal mortality ratio in Nigeria as 840 per 100,000 live births. On its part, infant mortality is at 88.4 deaths out of every 1,000 births, and under 5 child mortality is 195 per every 1,000 children. More alarming is that the life expectancy of a Nigerian is 47.5 years, compared to that of an American or Ghanaian, whose life expectancy is 78.3 and 61 years, respectively. Now, these statistics are a reflection of the state of the healthcare system in our country. While it may be government's responsibility to address the above, it can't be theirs alone. In the belief that as a complementary role to government, we as professionals in the health sector have a duty to raise the standards of healthcare as we see it, we established Tabitha Women's Health.
Tabitha Women's Health provides a list of services which includes routine and high-risk obstetrics, preconception counseling, breastfeeding support, general gynecology care, basic infertility evaluation and treatment, minimally invasive gynecology surgery, urogynecology, urinary incontinence and pelvic floor prolapse, perimenopause and menopause treatment, breast health, cancer screening, menstruation problems, comprehensive birth control counseling and prescription, adolescent health, pediatrics, family medicine, social services, wellness, and nutrition.
What makes us unique is that we offer advanced gynecologic, laparoscopic, and hysteroscopic surgery under the broad heading of minimally invasive surgery, so that people usually in Nigeria, go abroad to do. Laparoscopic surgery is really surgery in which we don't need to make a long incision on the abdomen. We don't need to cut you on the abdomen. We can just use very little holes, and we're able to do a lot more advanced surgery like hysterectomies, which is removing the womb, and myomectomies, removing fibroids, and other things that normally would be done in Nigeria using an abdominal incision, including also ectopic pregnancy. More of the hysteroscopy part is when we look into your womb from the inside, and we can also do a lot of surgeries, take care of fibroids, women that have heavy bleeding. We normally can take care of people that have problems with very dysfunctional uterine bleeding. We can do that without, again, making any incision at all on the abdomen. Also, based on the background and training of our physicians, we're offering clinical services in a more contemporary and personalized manner. Our outpatient facility is set up quite different than I have seen so far in Abuja, and we are adhering to the highest standards like we would if we were in the United States. Tabitha Women's Health is more than just a medical center. It is a center that has a mission to reform healthcare in Nigeria.
Over here at Tabitha Women's Health, the services that we provide for pediatrics include well child care, the management of the sick child, adolescent medicine, as well as developmental pediatrics, which is the branch of pediatrics that focuses on child development issues such as attention hyperactivity disorder, autism, cerebral palsy, and other child developmental problems. We look forward to serving you here at Tabitha Health by providing the very best care for your children. We ensure this by partnering with the parents to provide the best for the children. We help the parents promote a healthy and safe environment in the home, while we do our part here at Tabitha Women's Health in providing good health care for your children. We look forward to caring for your children, and we invite you to come and join us here in the practice. We have a terrific professional staff and look forward to serving you.
Tabitha Women's Health is essentially a team of women helping women. I guess you can describe it as a huge umbrella under which women of all ages can access care. As a primary care physician, I represent the first contact for previously undiagnosed cases in women and children. I also offer continuing care as well as urgent intervention where the need arises. We emphasize preventive medicine in Tabitha Women's Health by promoting fitness, exercise, nutrition, and outreach programs. We have a great team at Tabitha Women's Health, and I'm definitely proud to be a part of it.
As a well-rounded healthcare facility, Tabitha understands the importance of a stable and calm mind in staying healthy. That is why we provide excellent psychological and psychosocial support to those individuals or families who are coping with difficult illnesses and situations.
Tabitha offers a multidisciplinary approach to women's health care. Therefore, in looking at the holistic woman, it cannot separate the mental health issues that women deal with. And that's where the social services department comes in. By providing services such as therapy, counseling, individual and group, case management, and advocacy.
Our wellness program focuses on a personalized whole-body approach to health. We work with our patients to create a program that will naturally help to stop health issues before they even arise. Our nutritionists, for example, can design a good healthy meal plan, while our well-being experts can work with you to lose weight through exercises and generally living healthy. As part of its social responsibilities, Tabitha gives back to its community through community outreach programs and awareness.
Our outreach program is a form of community service that is geared to not only improving the quality of life for the individual, but also in developing the community itself. It can't always be about the government. We as individuals have to learn that the development of our communities depends on our individual inputs. Tabitha Women's Health believes that creating awareness, especially in the areas of preventive medicine, example, cancer screening, prenatal care, emergency obstetrics, pediatrics, is our own way of giving back and developing our community. Our logo says it all. A healthy woman leads to a strong family, leads to a great nation.
To effectively offer the highest quality medical services required, Tabitha provides continuous medical education and training in specialized areas.
I believe that every individual is entitled to receive the highest quality of medical services available. And to do this, the provider needs to be well trained in their area of expertise. I am not referring to medical school or residency or nursing school. I'm referring to continuing medical education. Health providers need to be trained on how to handle various situations, including emergencies.
In order to meet its commitment of providing the highest standard of women and child health care in Nigeria, Tabitha aims to provide quality services that reflect the quality it represents.
I believe the way we started Tabitha has really been, I call it our seed starts. It's really, we're starting small with high quality to be able to use that as a prototype. We are planning to extend our services well beyond women and children. Hopefully in the next year or two, we would have established a fully equipped inpatient facility, which will include an intensive care unit, maintaining our international standards.
Peter Schnatz. I'm the Associate Chairman and Residency Program Director in the Department of OBGYN at the Reading Hospital in Reading, Pennsylvania, in the United States. I'm also the CEO and Chairman of the Board of Faith Care Incorporated, an organization that brings free health care to needy people in different parts of the world, including Nigeria, Haiti, Siberia, Dominican Republic, and many areas within the United States. I had wished and hoped to be there today at this opening of the Tabitha Clinic to be a part of congratulating Dr. Chido Nwana for the wonderful work that she's doing and this great opportunity to begin the Tabitha Clinic. I was also on the faculty at the University of Connecticut quite a few years back when Dr. Nwana was one of our resident physicians, meaning she was learning the skills of becoming an OBGYN doctor. What a wonderful privilege it was, being her teacher, her mentor, her friend, and her colleague, watching her grow and mature and learn the necessary skills to become a competent and qualified OBGYN physician. She even came on one of our trips one of the years to a rural village here within Nigeria to help care for needy people. When she told me that she wanted to begin the Tabitha Clinic to bring care to women, but also to incorporate the ability to bring care to women who don't have access to medical services, it didn't surprise me, because I know what a wonderful, caring physician she is, desiring to bring care to all women that she can. In fact, I recently learned of her organizing a walk to bring awareness to cervical cancer, and that the funds which are raised are going to help serve needy people. Dr. Nwana, I'm so proud of you, of all the work that you've done and that you're doing, of this new Tabitha Clinic. I had wished I could have been there today to be with you and your family, but congratulations. You're doing a wonderful work. And all of those who are there celebrating with her, you're fortunate to have Dr. Nwana to be there to care for you and your families. She's a truly wonderful physician, and I wish you all well and the greatest success for the Tabitha Clinic. Thanks so much. Bye-bye.